David Hare is head of NHS Partners, a trade body for private healthcare providers, including the likes of Bupa and Virgin, whose members provide beds for the NHS.
All health systems need some sort of bureaucracy to hold people to the right standards, protect patients, ensure that billing is done properly, and so on and so forth. So actually ensuring that there is best value derived from whoever is providing that service, ensuring that patients are protected in terms of high quality care, all of those things are good things and important things that we need to put out there. The alternative is sort of throwing money out into the NHS and just hoping it gets properly spent. And I don't think we would want to go to those days, because ultimately it will be a bottomless pit and politicians and the public would quite quickly lose confidence and faith in their NHS. It needs some grip and focus, and part of that is holding all providers, public, private or voluntary, to account for the outcomes that they deliver. And where there are bottleneck pressures at capacity points like winter, where quite understandably operations do need to be cancelled, both patients themselves can agitate to go to an alternative provider, but also the system in that environment must also be looking at where else could that patient go? Could we find an alternative provider to treat that patient that bit quicker?
But if the NHS is under that intense pressure, private healthcare is there perhaps to help the patient get the operation they need under the umbrella of the NHS. It also makes that patient perhaps look differently at the NHS and think, this is not an NHS hospital I'm being treated at, it's a private hospital.
Let's be clear, over 500,000 patients a year choose to be treated by a private hospital funded by the NHS. For those individuals, they see that as NHS funded care. And what we know about private hospital provision is it's overwhelmingly good or outstanding.